See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hey, See You Now listeners, welcome to summer. As the temperatures rise and vacations are afoot, there's no better time to pull out the popsicles, pour some lemonade, and soak up uninterrupted hours of podcast listening. And to make your summer listening easy and enjoyable, we've created a summer See You Now playlist. Given that the U.S. and much of the world are experiencing scorching temperatures, with roughly 1 in 3 Americans living under an extreme heat warning, we've included some See You Now episodes that shed light on heat-related health matters.
Sometimes people think, oh, we'll start seeing problems around 2100 or maybe 2050. We are seeing changes now. Our forests are being cleared. We're losing biodiversity. We're having an extinction rate that's 1,000 times normal of the species on this planet. The oceans are acidifying. Land is becoming desert. We have soil, air, water pollution. We have changes in rivers drying up, extreme weather events. Climate is part of the problem. It's a symptom of the problem, and it's much, much bigger than that. We're seeing increased impacts on cardiovascular diseases. People who are living with respiratory diseases are certainly feeling the impact of a changing climate. Infectious zoonotic diseases, antimicrobial resistance, heat strokes, malnutrition, civil unrest and trauma and strife, and mental health impacts of seeing a place that we love, a land that we could bank on supporting crops, become disrupted to the point where our livelihoods are gone and a place that we love has been destroyed.
Wow, it's really hot out today. And once you start doing this kind of work, whatever the weather is, you immediately think of who does not have a roof over their head right now. And it really helps when, instead of trying to get 50% or 75% of our patients last minute shelters when the weather's obscenely hot or cold or rainy, we get to go, oh, we only need to find 25%. And recently when we've had inclement weather, we've been able to do so certainly easier than we have in the past, just because so few of our current patients are actually unhoused, which is a great feeling.
We're also thinking about how summer is a time when graduations and moves take place, and the perfect moment to check in on your voter registration status and think about its surprising impact on your personal and your community's health as we gear up for Civic Health Month in August and all its upcoming activities.
Every year, there are innumerable elections around the country, and those are the elections impacting things like, do I have groceries in my neighborhood? Are the parks where I live safe? Can I get access to good jobs?
There's almost 800,000 people on GoFundMe trying to buy insulin, medical care.
We can't even begin to talk about some of the downstream ways of engaging civically when we have nearly 1/3 of our voting age eligible patients who are not registered to vote.
Many people had never been asked or even had some myths about when you would or would not be eligible.
The first step is to help patients vote and have a seat at the table.
When we think about who are the types of novel messengers we need to talk with us about democracy and our vote, we need people who we actually believe in and view as people who are trusted messengers. Our healthcare spaces are a really innovative place to ask people about voter registration.
During the past year, so many conversations have been focused on employment, work, and very specifically the healthcare workforce, exploring in depth and detail what's working for work. And yes, even in our time off, we're thinking about work and its many dimensions, including what thriving, engaged, productive work environments and workforces look like, how you build them, and how you sustain them.
The role that I get to serve as Associate Dean, especially as a young Black woman, means so much to me because we want our nursing administration to really mirror the students that we serve in the same way that we want our healthcare professionals to really mirror the patients that they serve. Right now, that's not necessarily the case, and there's all sorts of research out there that says patients have better outcome when they have providers that they can identify with. Less than 1% of nurses have doctoral degrees. I'm happy to be a part of the 1%, but I have to also be a part of the change to increase that number.
Putting resources to people and putting resources to build out your workforce should be key for everyone right now in healthcare. So, like us, we have a homegrown program. So if you want to be a nurse, you work in EVS or food service, we work with you, make it possible for you financially, work schedule to become a nurse. So a lot of the interpreters go back to school and be nurses. Mm-hmm. And then we have bilingual nurses. They probably wouldn't be able to do that unless we helped them. Is it a costly program? Yes. And we now have lifetime nurses that are deeply loyal to Vidant. And so I think some of that thinking could help people looking at the long term, especially now with the workforce shortage that we have. I'm very focused on our EVS and food service, which about 60% of our EVS and food service workers are African American women. I'm very focused on helping them with their dreams. So they all have leadership development if they want it. If they tell me they want to go to medical school, we're working on it. They want to be a lab tech, we got you. And so I'm very focused on that. And I would say I'm focused on it from a humanitarian standpoint, but also just the realities of the workforce. Yeah. You know, in a town of 90,000, how are we, every hospital, going to staff itself in the next 2 years? We have people in the community. If we're a good environment with a great culture and we love them, they will work for us and they will be loyal to us and they will take care of their community. So this whole workforce advancement concept is something that I would wish all healthcare organizations would pivot to with great intention.
All right. So my name is Dr. Julius Johnson. Everybody that knows me calls me JJ or Dr. J. And yes, I have a doctorate of nursing. I am the president of the Greater New York City chapter of the Black Nursing Association. I'm an associate professor, chair, and I coach football. And I don't say all of that to brag, but I say all of that so I can tell you where I actually come from. I'm from Brownsville, Brooklyn, New York, which has the most New York City projects per square foot in the entire United States. I have friends that were killed as I was growing up, and family members and friends that died prematurely from death over and over and over again. And I say that because it has created a frustrating issue of how do we get Black men to care about their health? For those of you who don't know, Black men has consistently ranked the lowest in terms of health outcomes. Cardiovascular disease, diabetes, hypertension, prostate cancer, lung cancer, you name it, we tend to either be on the bottom of the barrel or near the bottom of the barrel. So for myself, as someone who come from this neighborhood, but have accomplished all these great things, I'm supposed to be responsible for creating some sort of a bridge. You look at all the things that we suffer from, and you see people not utilizing the services to prevent these diseases. Why are people not utilizing them? They don't feel safe in doctor's offices. Being in a unique position where I can see a lot of Black men, whether that's through football, through barbershops, through the Black Nursing Association, or through just walking and really paying attention in my community, it builds a relationship with those men. And as long as I can build a relationship, we can have future progress.
Summer signals taking a slower, more relaxed pace, affording maybe a little more time to listen, ponder, synthesize, and discuss weightier, complex topics that require deeper reflection, consideration, and commitment to progress. For just that type of listening, we've included See You Now episodes that go deeper into the rich, beautiful, incomplete, and complicated history of nursing and its power to change people, careers, and our world.
For us to really look at the way that different people came into nursing at different eras is honestly very humbling, because you can actually see how different voices and different cultures come together to shape the profession, and what they've done to make it a more integrative, more inclusive space since the profession started.
In terms of the History Month, it's like, oh, I finally see myself in this public-facing project. It's a reaffirming project, and it shows me that I matter and I'm making an impact in nursing.
And you don't often see what doors you're opening for others, and you don't often see the impact that you're really having on this longer, larger level.
There is so much of our profession and the healthcare of our nation that is intertwined with these historical periods that in aggregate give us the outcomes that we're seeing today.
These issues are complex. There's a lot of things interacting. There's a lot of people and institutions and ideas at play.
A lot of what we have uncovered across all of our stories has really been this piece of social innovation.
You have these organizations across the nation, and they're addressing these issues of Black health disparities in our communities. How do we deliver care to our communities who are excluded from the hospitals and clinics because they're Black? How do we increase opportunities for Black nurses and Black doctors to train?
Social innovation as the process of developing and deploying effective solutions to challenge systemic social issues is embedded into who we are as a profession.
That history is still alive today.
I just want to publicly commend and shout out everyone that has been involved in this incredible work. And it's painful work, and it's hard, and it's challenging work. And it's so necessary. And what I feel like the gap that this commission is closing is that it's bringing to light the lived experiences and decentering the white experience of nursing. Unless you're actively seeking to understand how other people are experiencing the same profession, the same hospital, the same nursing school, you could miss things. And you can end up contributing to a problem inadvertently. When we have national nursing organizations that are representing all nurses, what happens is, because of our professional history and because of our entrenched narrative, the default centers white female interests. And so I see all of the work of this commission as really trying to expand and include all nurses truly. When you look at the authorship of all of the organizations that came together to write it, these are the words and the documents and the policies that I really think are going to hopefully profoundly affect the trajectory of the profession going forward.
Racism, it's assaults on the human spirit.
The data was telling us that different care was being offered to different patients.
It's about an ideology of superiority.
We are having to confront the reality that the media continues to be too white and too male.
It's about moral suffering and physical harm.
There are differences in outcomes depending on your skin color in the United States.
And it's about systemic injustices and inequities.
Part of the solution absolutely has to be collaboration across institutions to figure out how to be better at being anti-racist.
We believe that as an industry leader, in working with others, we can help create a world where the color of your skin is not a determinant of the access to care quality or your own health outcomes.
We just have a whole lot of work to do.
The drive to create organized, skilled care within our societies is a fundamental human impulse. Nurses are just as key, if not more key, to outcomes overall than anyone else in the healthcare team. As long as we underestimate the insight and the expertise of nurses, we are going to continue to struggle to find well-being. I think the world needs this book because as long as the general public does have an impoverished understanding of nursing, as long as we underestimate the insight and the expertise of nurses, we are going to continue to struggle to find well-being. And I really believe that. And I'm a person who has needed care. My family has needed care. And I had questions, so many questions. And I think so many people feel very lost when they need healthcare. And so the book really was my process of trying to understand what is nursing? What is this vast scope of nursing? And what are we leaving on the table as a society when we don't elevate nursing knowledge and expertise?
So whatever comes your way this summer, whether you're in a car, on a boat, in a plane, on a train, or just hanging out, See You Now has you covered with great listening, learning, and inspiration to enjoy and share with your friends and family. You can find a complete shareable playlist in our show notes. And before you head off for more summer play, we are thrilled to announce that See You Now had 3 episodes named as finalists in 3 categories for the Share Care Awards. Established in 2019, the annual Share Care Awards honor the creators of best-in-class productions and programs that promote well-being, embody the spirit of sharing care, and creative use of media to empower people around the world to live healthier. The 2023 winners will be announced October 9th on stage as part of the HLTH 2023 conference in Las Vegas. More details on that are also in our show notes. Finally, we want to hear from you. What problems are you seeing and solving? What discoveries in history are you making? Email us at hello@seeyounowpodcast.com. For See You Now, I'm Shauna Butler. Stay safe, and thanks for listening.
You're a See You Now fan, and a great way to express your enjoyment is to take a moment to subscribe, rate, and review the podcast, and more importantly, share it with others. Good health is a team sport, and the more fans we have, the healthier we all will be. Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.